Age-Related Macular Degeneration, AMD for short, is the leading cause of irreversible blindness and visual impairment worldwide. Most people over 60 will have at least a few drusen, little clusters of waste material beneath the retina. Drusen alone aren't always a problem, but when they're in the macular area, that's when vision starts to suffer. What AMD does to vision. AMD causes damage right in the center of vision, the macula, which is responsible for fine detail. Central vision is affected first. Most patients still keep peripheral vision. Only a small percentage progress to total blindness. Two types of AMD. Dry, non-neovascular, nonexudative. 85 to 90% of AMD cases. Outer retinal layers slowly break down, drusen appear. Drusen outside the macula equals no symptoms. Drusen inside the macula, gradual blurring, often noticed while reading. Progression is slow, but vision loss can still be significant over time. Wet, neovascular, exudative. Less common, but more aggressive. Often has abrupt onset. Patients say straight lines look crooked or letters look broken. Caused by choroidal neovascularization, abnormal blood vessels grow under the retina. These vessels leak fluid or blood, lifting the retina and distorting vision. Some cases respond to laser therapy to stop leakage. Medical management. Dry AMD. No proven cure or treatment for advanced disease. Wet AMD. Main target is stopping angiogenesis. Abnormal blood vessel growth is driven by vascular endothelial growth factor. Anti-VEGF drugs, like ranibizumab and brolucizumab, are injected into the eye to slow or stop vessel growth. Nursing management. Amsler grid testing is key. Patients use it at home several times a week, one eye at a time, with their reading glasses if needed. They're looking for distortion, wavy lines, or faded areas. Any change means a call to the ophthalmologist immediately. Digital versions can detect changes even earlier. Patient education. Preventing eye injuries. Chart 58-11 highlights. Because eye safety is always part of prevention. At home, keep sprays pointed away, use shields on frying pans, wear goggles with harsh chemicals. Workshop. Safety glasses for flying debris, sparks, or chemicals. Children. Teach safe handling of sharp objects, supervise risky toys, avoid projectile toys. Garden. Avoid standing in front of lawnmowers, pick up stones, watch for low branches. Car. Goggles for battery work or grinding metal, use a flashlight, not an open flame. Sports. Helmets and protective eyewear for high-risk activities. Fireworks. Avoid explosive devices, wear protective lenses, never let children ignite them. Bottom line. AMD is about preserving the vision a patient has for as long as possible, especially central vision. Dry AMD is slow but steady. Wet AMD can be fast and devastating. Knowing the signs using Amsler grids and acting quickly can save precious sight.